Now, what is something that will haunt you that happened in Gaza?
We have only one ventilator. He got shot in his head.
Mhm.
His brain has come out, and he's eventually gonna die.
Right.
So this is the other person who's got kind of similar injury, but he might survive. You know, there are times when people come, like they call, "Come here. Do you know this person? Because he's dead." I'm like, nobody's able to recognize. So they call people like around wherever and they say, "Did you recognize him? Did you recognize him?" And there were like instances where like 50 people come and they say, "We don't know him."
هنا مروا وكانوا قدوة للناس هنا مروا وكانوا قادة أطهار.
Assalamu alaikum wa rahmatullahi wa barakatuh, brothers and sisters. Welcome back to another episode of UnityCast, brought to you by Unity Islamic Center. Today I'm your host, Abdullah bin Jamal, and I'm joined here today with...
Dr. Aslam Mohammed.
Give us a little brief introduction about yourself.
So, Alhamdulillah, I'm an ER physician. I'm based in New Jersey. I'm like a former resident of Des Plaines.
Mhm.
So I've been here local, and I have been here, like I visit here quite often every month. And Alhamdulillah, I was blessed with an opportunity to be in Gaza in the first 2 weeks of August to help the people out there, being an ER physician. So that's kind of my background. So
SubhanAllah. I want to start off by saying Jazakallah khair. May Allah increase you for joining us and obviously your great work. How was Gaza? What was it like?
yeah, for Jazakallah khair for having me here. So you know, unfortunately, what we see in the news is what I experienced there. Much more worse. You know, we don't see, because me being the ER physician, I see when people come in the hospital.
Right.
And I see the injuries, and I see my limitations, and I see how frustrated I am, and how helpless I feel, because being in US, the way I can treat patients is completely different.
It's not the same, right?
Yeah, I feel like I'm practicing medicine like 100 years ago.
SubhanAllah.
So unfortunately, it's not that it was not there ever. They had everything, but it has been taken away from them. They have CAT scans. They're not functional.
Right.
You can repair
So
them.
outdated equipment, you're saying?
The equipment is there, but the problem is it has been damaged, and you can't repair it because of the blockade. The things you need to fix those things are not being allowed.
Wow.
So
How do you kind of like combat that? How do you go around that obstacle?
we just go to the ancient medicine. I'm like, if, for example, if I get a patient in an ER, I have a luxury of having like one nurse with me.
Right.
And I have like all the labs at my disposal. I have all the imaging at my disposal. So just to give an example, a scenario, if I get a person who has got some bullet wound to his chest, we do an ultrasound to figure out like if there is blood inside the cavity, if we have to do any life-saving measures like put a tube there, or if it's an injury to the heart, so we have to put like drain the blood around the heart so that the person does not die.
Right.
We have to do that very blindly. Oh, okay, we guess we can't see that. Maybe with the ultrasound, this is little like shows what we call like EFAST. It's kind of a test done to see if there is like any damage to the vital organs or bleeding inside your
Like internal bleeding?
Yeah, internal bleeding in the cavity. If that's positive, if it's in the chest, we put a chest tube. If it's in the belly, the patient goes to the OR.
The ER?
That's in the ER.
Oh, okay.
So, we have to triage and say, okay, look, this patient is coming. He needs to go to the OR. If he doesn't, then he will bleed to death.
What's the difference between the ER and the OR?
So OR is the operating room.
Okay.
So he needs to go for the surgery.
I see. Okay. I'm not familiar with that. But
So ER is the emergency room.
Yeah.
So like we triage, we see like, if we can do procedures to save them right then and there, we do it.
right. And then the step 2, like the
Yeah,
next measure is the OR.
Yeah. So we try to stabilize the patient, and we know he's bleeding inside,
Mm.
what we do is a temporary fix, but it needs to be stopped.
Right.
So here is the thing: you're bleeding inside your body.
Mhm.
The only way you can stop is open it up, close the bleeding.
Right.
And in the meanwhile, you have to do the blood transfusions to replace the volume, because otherwise the patient is going to go in shock and die.
Mhm.
So that being said, for example, if I know, okay, the patient is bleeding, I took the blood test now. After half an hour, because if the OR is occupied,
Mhm.
you cannot send him because there is no surgeon. He's doing another surgery. So you have to do the replacement. To look at the blood count again, the RBC or your hemoglobin, you cannot do it because the labs don't have the CBC.
And that is what?
Yeah, I'm like, you cannot. You just have to treat them blindly. Okay, he's
You mean like the equipment? The CBC is like the type of equipment you need to get this like procedure done.
the CBC is a kind of a lab test which says how much of blood loss you're having approximately.
Mhm.
So this is a normal value.
Mhm.
If it goes beyond this value, and like how fast it's falling and how much it has fallen, it says how much of volume of blood you have lost.
I see.
You can't, you can assess. So
Mhm.
instead of doing that, because those tests are not available,
Mhm.
we have to physically look at the amount of volume he's bleeding.
So that's what you mean. You're kind of like operating blindly.
Yes,
So
and
kind
like
of,
we are functioning blindly. Then the patient comes with a skull injury, like he's got something. We don't know if he's got like a bleeding inside or it's it's just a scrape wound,
Mhm.
and how bad it is, where it has gone through. We need a CAT scan. So what we do is we see a patient here,
Mhm.
we try to stabilize him,
Mhm.
and if there are no ventilators available, a hospital which is getting like 400 to 500 patients a day, and if it has got 10 ventilators available, we end up just bagging the patient. Like we put a tube in and we ask the relatives to keep bagging it,
Subhanallah.
and they do it for hours.
Wow.
So this is like basic things we don't see here. It's
Right.
just like I'm talking a script from out of some play or something like that.
This is kind of something that's like ancient almost in a way. Is it hard to get into Gaza? I know it's I heard it is, but right now if a medical professional wanted to go and help the Palestinians there, how hard is it? And is it like easy enough for you to go back right now?
I'm not sure, because I'm not sure if I would be allowed inside again or not. It just depends. So it's a process. So what we do is, you are with an organization and you tell an organization, look, I'm a so-and-so doctor.
Mhm.
You send all your credentials to them.
Right.
And what they do is they, go through all the process, verify everything,
Mhm.
and it goes to the different levels of security agencies.
Mhm.
And it takes roughly 2 to 3 months, to get all this thing process done.
Mhm.
And in the last, what they do is it goes to an agency called COGAT, which is basically, I don't know what it stands for, but it's an Israeli security agency or something like that.
Mhm.
So they don't tell you, like if I'm supposed to go on a Thursday morning at 7 o'clock, the final list comes at like Wednesday night around 6 p.m. or 8 p.m.
Mhm.
saying that these people are going inside now.
So it's like very short notice.
Yeah. So with my team, there were supposed to be 4 doctors,
Mhm.
and 2 of them got the permission and 2 of them did not. So we were physically in Jordan, in
Mhm.
Amman, hoping that we are going tomorrow morning.
Mhm.
And those 2 people got denied hours before they were. So and one of them in there was like, he had gone before and he has been denied.
Mhm.
So you never know, because you have gone in the past and you have, nothing wrong with anything,
Mhm.
but you come out, you may not be allowed inside again.
Subhanallah.
Any reason? I don't know. No
Mhm.
explanations provided.
What kind of like made you want to go in the first place? What kind of like made you have that feeling like I want to go to Gaza and be helping out all these Palestinians that are going through it?
See, when not being doctors coming from like back home, we were never like inclined towards the money. Like we wanted to be doctors because we wanted to serve the community in the way we could.
Mhm.
Then for 2 years you see all these injuries and you see like, this is my special, I can help there. And you feel helpless because first of all, like doctors, maybe most of them are very soft at heart. You can't see people suffer. And then being a Muslim, and you see all the suffering these people are going through, and when you can help them out, then you want to go there. And that's one of the things, like, just being part of a Muslim, it's your responsibility. It's not just because it's Palestine. If it was anywhere else,
You still do it.
Muslims would go and help that.
Right.
I'm like, that's the part of how we have been. It's part of our iman. I'm like, no matter what, you have to help people out, and that's it.
How does your family like feel about you going when you first told them?
They were like, worried, upset, but
Like any family should be, right?
yeah, and alhamdulillah, like they understand the situation. They were like, if you can go and help, you can go and help. They were like afraid of stuff and what people are seeing, things happening around, but alhamdulillah, they were supportive, and may Allah reward them for that.
I mean, that's right. Was there like a specific patient that caught your attention the most that you still remember now?
So I had this, when we talk about doing ancient medicine, you probably would have seen how people used to do surgeries without pain medications. Like if, you watch movies and stuff, like they just make the people
Without any
without any
anesthesia,
anesthesia.
right?
So imagine that kind of a pain. Like there was this kid who was in the ER because he did not have any other bed. So the only bed was available in the ER. So I was there for 2 weeks. So I think he was there almost for a week while I was there. And this kid had got shot in his back. So they were shot. He is probably 11 or 12 years old.
Wow.
So he had this shrapnels in his back, like spine.
Wow.
So he was paralyzed
SubhanAllah.
in both his legs. He was able to move one of his hands. And this kid, every time I was anytime you're in the ER, you hear him shouting in pain.
Oh, man.
Like for one whole week, you imagine that. So every time he makes a little movement, like turns around, or if his mom is trying to clean himself or clean him, I'm like, you could hear like shouting. And we did not have any pain medications to give to him. I'm like, just imagine this kid. He had the injury before I went there, and I was like, why this kid is shouting? I'm like, I'm in the ER.
Right.
So then I go and talk to the mom, and she says, then when I look at his pictures, he's got like this I think it was shrapnel in his back, and
You look like that X-ray.
yeah. The X-ray. So he had this fragments from when the bomb bursts. You have the small
The shrapnel,
fragments.
right?
So in his back, so that caused him paralysis, and with that he became like sensitive with the pain. So any little movement, and he had like multiple fractures of the vertebrae,
SubhanAllah.
and he was not being given any pain medications because they don't have. And then we requested. I had few. One of my pediatricians was with me. I said, "Can you give him something?" It's like that kid, 24/7. Anytime he moves for a
It
week,
hurts, right?
I could not hear him anymore because he was discharged home.
Wow.
But again, the thing is, when he went home, he did not have any pain medications.
So he was just suffering the whole time, just because there's nothing to
Yeah,
kind of numb the pain.
numb the pain. That's it. I'm like, you probably what they had was a Tylenol level, because anything more you need for like more sicker patients. I'm like, there are people who are with bigger injuries. It's not. I'm saying it's not a big injury, but there are worse injuries than that.
How can they like successfully get those type of like painkillers in like inside those like facilities or like wherever you guys are
The blockade has to
operating?
go.
So there's no other way.
There is no other way. I'm like, you imagine, if I take what I was supposed to carry as per the regulations is your own personal medications.
Mhm.
And if I'm talking about 500 patients, or let me take the least number, 400 patients a day.
Mhm.
And out of that, 100 are wounds
Mhm.
from all this.
There's no way you're gonna have enough, right?
And
SubhanAllah.
this has to come in trucks. I'm talking about one department.
Wow.
And this is daily number coming inside the hospital. And you have all the past 2 years, you have injuries. So let me give you an example. In US, if we have a patient who had some injury, like a motorbike accident,
Mhm.
he gets fractured,
Mhm.
and he takes pain medications for years,
Mhm.
or probably for rest of his life.
Mhm.
And he gets like narcotics
Yeah.
to numb him up, and still they are in pain. And imagine these people who for 2 years, they are amputees. They have like retained bullet fragments. They have like retained shrapnel, and they're in pain all the time, and they don't have any pain medications.
SubhanAllah.
And this is one day, if I say 100 people are being added for one hospital, imagine if I take like 5 to 10 functional hospitals, so-called functional hospitals.
Right.
So 1,000 patients every day,
Mhm.
pooling up, and then the previous ones. So imagine how many pain medications they need each day, and
Wow.
you need trucks
Right.
to come inside.
Right. You bring in your own like little like box of your own personal. It's not
Yeah.
gonna be no way.
I can
It's
get
gonna
like
be-
15, 20 tablets. What's gonna do? Nothing.
Yeah. SubhanAllah.
So the main thing is the blockade has to go,
Mhm.
and these things need to come, because these are not luxury.
Mhm.
These are like necessities.
Wow.
Like people are suffering. It's not, this is not somebody else. These are like innocent civilians. These are like small kids. These are women, and these are not like, whatever they want to call, but these are like innocent civilians. They are suffering. And this is the only time seen like where the medical facilities have been targeted. And I have been in the medical facility for 2 weeks. I didn't see anything. You see common people, you see young kids, you see women coming, and you see people who have gone to collect food getting shot and bombed coming.
And like they're being like aimed at on purpose. Like the IDF soldiers, they know who they're shooting at.
The people come, they are monitored, there are cameras, there are drones, they visualize people are empty-handed. They are carrying the food which they are being given by them, and when they're going with the food or coming for the food, they are being shot.
SubhanAllah. And some of these I see online, they are headshots at children. Like what type of enemy is gonna look like a child that's just wanting food is what hurts the most, out of the situation.
Unfortunately, if we talk about humans, I can tell you, but we are living in a world where we have humans and pseudo-humans.
And that is
I'm like, people act to be human, but they are not.
pseudo humans.
Like, they say, oh, we are humans, we are doing everything for the good. You call them to give food, and then you
stab them in the back, right?
Yeah. It's basically playing a game with them. Like, if you see those Squid Games or like, Hunger Games,
Yeah.
it's become, because you are seeing, visualizing, and shooting or bombing them. It's
We're taking
like,
advantage of right.
it's like not a normal person will do it.
It's only shayateen that would do this.
You are either a psychopath
Right.
or you're a sick person.
Or shaitan, right?
Yeah.
Like straight up like shaitan. SubhanAllah. Alhamdulillah.
Even shaitan would be ashamed of them.
Right. That's crazy.
I'm like, they are much worse than that. And I'm not seen shaitan, but
Right.
you can't see people suffering. I'm like, small kids.
Mhm.
You can understand, like, if you're having some war with somebody else,
Mhm.
but this is food distribution.
Mhm.
It's not they're coming, you're calling them. You have starved them and you call them,
Mhm.
and then you shoot at them. And as you told, the most of the injuries are to the head, to the neck, to the
Wow.
chest, because these are like vital organs.
Mhm.
Then there are levels of suffering here. You call, you shoot them. If they survive, if they're shot in the head, they might have paralysis or defects from that
Right.
injury.
But it's 90%. They're gonna like pass eventually.
Yeah,
Like soon. I mean,
yeah.
if it's a headshot.
You might try to save them, but again, the thing is, you do all right things in the ER.
Hmm.
Then again, you have to treat them with antibiotics.
Right, and it's very limited, right?
It's very limited. You have only one antibiotic I have seen, and that's not an ideal antibiotic which we use here. So the chances of them getting infection and having a prolonged painful death is high. So you either kill them at the spot. If not, you are ensuring that they suffer for the rest of their life in whatever way till they are alive. So it's like very twisted, sadistic minds, which like humans can't do it. I'm like, that's why I said they are humans and pseudo humans.
It's honestly like it gives me chills that kid that you were just mentioning, just him, right? He has like right now he's in pain, and he has no option, and that's like the scariest part about this. He has no option. Like the only options he has is to just feel the pain, every single day, or just die and be over with, and it's something that really like brings chills to my skin.
This is not only him suffering.
Right, and this is like using him as just an example. Imagine like all the other
No,
children.
just look at his whole family. He's got younger siblings, and he's got mother and father, and he's 12 years old. Then imagine somebody has to be with him, and he's all the time in pain,
right,
and all his family is affected. It's like one person got injured, and the whole family.
it's like
is
a domino
suffering.
effect, right? Subhanallah. What I'm sorry, go ahead. I didn't mean to.
So that's one thing. I'm like, these are like one small story,
Mhm.
and this is like almost every family has one story. I'm like, imagine 2 million, 3 million population.
Mhm.
Everybody has lost somebody in their family, or somebody is suffering in the same or similar way.
Mhm. Would you consider going back? Like if you had the chance now, and it's obviously it's tough to get in. It's not 100% chance. It's not 100% chance you'll get in. But if you knew that you would you go back?
Inshallah.
Inshallah, is that your plan?
Inshallah, that's the
May
plan.
Allah increase you. Wow. What changed about your mentality as a doctor after visiting Gaza?
I'm like, I see how people are, knowledgeable. They see things, but they are still blind. When people react, not everybody is able to go, but when you go and see the contrast between here and there, where the people react, they look at the news, 46 died today, 90 died today. It's just a number.
Right.
Never hits a headline. But somebody's dog goes missing. Somebody's dog has died, or somebody got diagnosed with cancer. It's a headline.
Wow.
I'm like, this is
Not fair.
it's not. I'm like, it just shows like how hypocritical the people are. I'm like, this has opened up a thing. You are not living in a world which is fair.
Not at all.
I'm like, people just pick and choose what they want, and whichever gives them, I don't know what kind of a satisfaction, they go after it. But they don't support the truth, and they don't support what is right, unless and until there is some outcome out of it.
What was the first time that you obviously this whole like trip that you had was I'm sure it was emotional. I want you to just name a time where you cried, and why it was so hard for you, why you had to cry. I'm sure you had a lot of moments where you shed a lot of tears.
Every time you see a person who could be saved easily, like here we don't let people die unnecessarily. Like if we can save, we do everything to save the person.
Mhm.
But there we know, if we had this equipment, we have felt the life slip through our hands with other stuff we could have done it. And it's being a Muslim, if it's time, it's time. But when it goes through your hand, I'm like, you feel helplessness, that you could have done better, you could have done this. But being in practice and not doing all these things, that helplessness. There was one of the incidents where I saw like 7 or 8 kids bought in. They were playing soccer
They all brought in at once.
all at once. 4 or 5 of them were brought dead. They were playing soccer and they were bombed by a drone. And these were like kids playing soccer and it was like 2 blocks from the hospital. And I have to wait for the translator all the time because they speak. I said, where are these kids coming from? They said, oh, this is the one, because we heard a loud explosion. Like the more the building vibrates, the more nearer to us. So they said, oh, this is from that explosion. The kids, I said, why the kids? They said they were playing soccer on the street. And this is like a visualized attack.
Like there's no way that they didn't know what they were doing.
Yeah, it was kids. I'm like, they're playing soccer. It's on the street. I'm like, they're not hiding in between the buildings.
Wow.
And they're seeing it. And there is a human, or supposed to be human, who did this. And when you see this, parents come in, and you just have to say, like, he's dead.
Wow.
Like, few of them had their brains out. I'm like, he is dead. I'm like, you can't do anything. So the feeling when, like, the people think, when you have this last moments where you have a little brain activity, but there's nothing you can do. You have this deep breaths or like a spontaneous breaths here and there. Not everybody thinks that people, they think they're still alive, but the reality that they're dead. And when they say, like, he's still breathing, I'm like, that's the hardest part. I'm like, no, he's not.
Oh, subhanAllah.
So that's like one of the things, like when I saw this 5 or 6 kids, like all of them kids, and only 3 survived. And I think one of them had to go through an amputation because his whole ankle was gone. And this is the,
I was gonna ask you, like, what about a time that you felt hopeless, but after you just mentioned that, it seems like, if you're a medical professional, that's the most that that's the feeling that you feel the most with the minimal equipment that you have there and the minimal medicine that you have there. SubhanAllah, that's very heartbreaking. What is something that the world needs to know? You went there, you've seen a lot. What is something that the world, they have to know because they're not seeing what you're seeing?
I wouldn't say the world is not seeing what I'm seeing.
Or for the most part, you're like in the inside of it.
Yeah, they are denying what they're seeing, and they're still not doing anything about it. So the thing is, this can happen to anybody anytime. So this is like basically abuse of your power. So anybody in power can do this. So if you don't stop it now, or you don't oppose it, it will become a common practice for somebody else. And then at that time it will become common. I'm
like normalized.
So it will become normalized. This is what is happening. I'm like, for 2 years now we have been hearing and doing nothing. And this is like a daily routine there that happens, that people are killed, like 20, 10, 15. It's just become a number. But unfortunately, this is like when people who are like blinded by power and not stopped in time, this is like a disease that is going to spread to rest of the world, and nobody will be immune against it. Like sooner or later, it's a part of a nature. I'm like, it's going to spread. And this is like a rabid disease. It has got no cure if it's not stopped in time, because it's limited. You stop it right now. If not, when it spreads, it kills you.
What are some things that us, the people watching, the audience, can do to help the Palestinians in the situation?
So as I told you, you correct yourself first, make dua for them, and then what you can do is you can talk to your representatives
Who are?
for saying that, look, this is happening, this is wrong. whatever your political reasons are, but this is beyond humanity. And this has crossed all the limits. There are like a lot of red lines that have been crossed. It has been told by each and every organization that this is a genocide. This is this shouldn't be happening, and it's still happening. And like we are kind of a moral model for the world, saying that, okay, we can stop it, but we are not stopping it. So we have to keep telling them, like, wake up in the morning, flood your representatives, go and meet them.
When you say representative, you mean like people of power in our community?
In your community, you are like, congressmen, your senators, go meet them and say that, look, this is wrong. This is not, whatever you're doing is, these are innocent kids, civilians, they can't be harmed. This needs to stop. And it has to be like everyday routine. It has not to be only a holiday thing, like where you go, okay, today is my day off, what I'm going to do. There's a protest going on, I'm going to go in there. But that's not going to be effective.
Wow.
It has to be like every day, every morning.
Consistent.
I don't say you don't have to protest, but there is nothing to protest. You have to just make those people understand that this is wrong. And once they understand this is wrong, they will stop it. Because nobody's telling them repeatedly. What they are being fed is, okay, this is why we are doing it. We are justifying the reason. And they are just hearing one part of it. When the other part says, okay, this is wrong, whatever they said is not justified, that's all wrong. When they hear both in the same amount or more than what they're saying, then it affects them. Right now, they only hear one thing. And whatever others are saying is very ineffective. So that has to increase, and it has to increase in a nice way. They are humans too. They have their limits.
They'll break eventually.
They will break eventually.
Right.
So if there is any humanity left in anybody, they will eventually break. But we have to push to that limits.
Right.
Like whatever you can do legally, you have to do it.
We took a lot of your time. I appreciate you. I want to conclude with one last question. Like we mentioned, you've seen a lot. What is something that's on your mind right now? What is something that will haunt you that happened in Gaza?
I have seen a lot. There are a lot of things. You don't want to remember those memories, to be fact. You have seen so much death. You have seen people crying, families losing multiple people. And there are times when people come, they call, come here, do you know this person? Because he's dead. Nobody's able to recognize. So they call people around wherever and they say, did you recognize him? And there were instances where 50 people come and they say, we don't know him. So this is a routine,
just an unknown person that's that can't be identified by their
usually when you go to food distribution sites like Gaza humanitarian corridor, there are hundreds of people going to collect food, and they come from different parts,
right?
And he gets shot or something happens, everybody gets him here, and nobody knows who he is,
right? They're just there with him at the time.
Yeah, and then we have to make decisions. If some family is there, it becomes, an unknown person who has passed away, or if you have to do some procedure, we just do it. There is no consent, nothing like that.
Right.
So that's another thing is very commonly seen, where you get this and people don't recognize. And there are times where we have to, there was an instance where I was having a discussion with the other doctor, saying that he said he wants to intubate this patient. I said, look, we have only one ventilator. He got shot in his head. His brain has come out, and he's eventually going to die.
Right.
So this is the other person who's got kind of similar injury, but he might survive.
He's more like I guess you're able to retrieve, I guess, his consciousness. He's more revivable. You should say.
Like,
You
yeah,
could say.
more, yeah, you know, the
More of a
chances
chance
of his
of survival.
survival are better than the other one.
Right.
I won't say like high, but better.
Right.
So that makes a very, you know, these are not decisions you make like once in a while. This is like multiple times in a day.
So this is common for you medical professionals there.
Like especially in the ER, because we see like we have to decide then and there. Either you go on ventilator, if you cannot, then we let you go.
And you find yourself in a position where you're kind of trying to prove your case to the other medical professionals how this person should get the ventilator or like certain equipment, and they should be prioritized, no?
You know, they understand. They have been seeing this for like 2 years.
Mm-hmm.
And when I say like they want to save everybody,
Right.
And
As
yeah.
all of them should, right?
but again we have like limited resources. So ER has like multiple beds. The worst zone, which was like 6 beds, where we see, like as I told you, the vital organs injury, head, chest, abdomen, active bleeding. Then there were times where people dying on the floor. We could not attend them because in time, because everybody is critically injured. You know, everybody needs attention.
Right.
And you know, we triage people like depending upon the seriousness of their injury.
Mhm.
But when 15 people come with the same level of injury, how many you're going to help with limited hands?
Wow.
As you told, like in the past, you asked me a question, the medical professions, they need all, these people have been working tirelessly for 2 years and they have not seen any days off. They need all kind of help. Like they were specialists, they are not available in Gaza. So for example, you need a vascular surgeon. Basically, it's like the one who repairs your blood vessels.
Mhm.
So when you have some critical injury, like gunshots to your, you know, arms or legs, where you hit a blood vessel, if that's not repaired, there is no blood supply to the part distal to it, and that part dies.
Has to be amputated.
It has to be amputated. The fact that if you have a surgeon there, like the vascular surgeon,
Mhm.
he can try to fix it and save the limb.
Right.
So these are the things like they require every specialty, the psychiatrist, right? After all this trauma, the psychiatrists, you know, they're humans,
Mhm.
so they have been affected.
Mhm.
But unfortunately, they cannot go in. And even if they can go in, the problem is they are not the priority. You get my point? Right now, the priority is to save more people with more serious injuries.
Right.
I'm not saying that, you know, their problem is not serious, but that could be pushed back a little.
Right.
But we don't have all those specialties.
Right.
So on a regular basis, there are only 2 groups going every week,
Mhm.
Tuesdays and Thursdays. And maybe each group may have 4 to 5 doctors.
Okay.
So they go for like 2 weeks
Mhm.
or 4 weeks or
They
a month, rotate.
Right.
So 10 doctors
Mhm.
on an average every week for 2.5 million population.
Wow. That's like the ratio is not right.
Yeah.
Wow.
So you need more doctors, like all specialties, but again, you have to prioritize.
Right.
Surgeons, orthopedics, vascular surgery, neurosurgeons, like people who can fix the damage that has been done.
Wow.
And like after certain time, there is nothing anybody can do. It becomes more cosmetic.
Subhanallah. I apologize. I don't mean to remind you of the things that happened, you know, back when you were in Gaza. I really wanted to hear that, because I kind of want the audience to kind of feel that those chills, you know, they get when they hear about people like this is actually happening. People are actually dying, you know, and it's like a wake up call for them. And like I want to say thank you again for joining us today.
So thank you for having me.
It's been a pleasure.
I hope it, you know, helps people out in any way.
Mhm.
And like, you know, we can't do much, but we can't just give up doing something.
Mhm.
Saying that, you know, whatever we definitely, even a small thing we make will make a difference. So we just have to keep trying, never get discouraged, and you know, things will change for better one day or another. It's our opportunity to be a part of, for getting the change for the world. So inshallah, we will do whatever we can, and we should.
Inshallah. Very, very well said. I appreciate that. And I appreciate you guys for watching. Barakallah feekum. And inshallah, join us for our next episode here at UnityCast. And Assalamu alaikum wa rahmatullahi wa barakatuh. Barakallah feek, Shaykh.